7 visible signs on your skin that your heart is sick. Have you ever imagined that your skin might be giving you signs that your heart is in danger? And worse, if you ignore these signs, you might be missing the chance to prevent serious diseases, such as heart failure, endocarditis, or even a heart attack. It's a series of signs that appear subtly, but reveal serious failures in the body's oxygenation and circulation. A detail that seems small but can make all the difference between an early diagnosis and a fatal complication. So pay close attention. In this video, you will learn about the 7 visible signs on the skin that show the heart might be sick. One by one, with details, explanations, and what to do if you identify any of them. It's not an exaggeration. It's prevention. And maybe this is exactly what your body needs, for you to stop, observe, and listen to what it's trying to say. Your heart might be asking for help, and it's doing so through your skin. So come with me. Chapter 7. Purple fingers or lips. Have you ever noticed your fingers or lips with a purplish color, especially on colder days or after physical exertion? This phenomenon, called cyanosis, can be much more than just a simple effect of the weather. It can be a warning sign that the heart is struggling to properly oxygenate the blood. When the blood circulates with low oxygen levels, the skin on the extremities tends to take on this bluish tone. This is one of the most immediate visible signs of serious circulatory or heart problems. Cyanosis happens when there is a decrease in oxygen transport to the tissues. This can occur due to heart failure, valve problems in the heart, or even lung diseases that impact blood flow. The body tries to compensate, but when the heart can't meet the demand, the skin reveals it. Often, this condition appears subtly, and the person does not realize it's a symptom. That's why paying attention to these changes is essential to act in time. Fingers of the hands, feet, and lips are the areas most affected by cyanosis. This is because these regions are farther from the body's center and receive less blood when circulation is compromised. If the problem is persistent, it doesn't limit itself to cold, but becomes a sign that something more serious is underway. In children, for example, cyanosis can indicate congenital heart diseases. In adults, it is often a symptom of advanced heart failure. Another important factor is to observe when the color changes. If it happens at rest, without effort or exposure to cold, the risk is greater. This indicates that the body is unable to maintain a good oxygen level even in basic conditions. Also, symptoms like shortness of breath, tiredness climbing stairs, or chest pain, if present alongside cyanosis, are emergency signs. It's not an exaggeration to say the body is literally calling for help. In some cases, cyanosis can be accompanied by cold extremities to the touch. This happens because the body, realizing the heart is failing, redirects blood to vital organs like the brain and heart, leaving the extremities secondary. It's as if the body is trying to protect the essential, sacrificing what can wait. However, this redirection shows that something is seriously wrong with cardiac function. A silent but visible alert. The good news is that cyanosis doesn't appear alone, it comes with context. That's why it's essential to understand the whole picture. Medical consultation, accompanied by exams like electrocardiogram and echocardiogram, can identify the origin of the problem. The earlier the diagnosis, the better the prognosis. The heart can be treated, but it's necessary to listen to the signals it sends through the skin. Chapter 6. Yellowish spots around the eyes or elbows. Have you noticed small yellowish spots around your eyes, or even on your elbows? These spots, called xanthelasmas, are more than an aesthetic issue. They indicate a buildup of fat under the skin, a sign that cholesterol may be elevated in the blood. And high cholesterol is one of the most known risk factors for heart diseases. The body warns when there is excess circulating lipids, and these spots are one such warning. Xanthelasmas appear slowly, like small, soft yellowish plaques. Often, they are ignored or mistaken for signs of aging. However, their presence is an important clinical marker, indicating something is out of balance internally. The fat deposited there is also accumulating in the arteries, reducing blood flow and making the hearts work harder. In other words, what appears outside reflects what happens inside. It's common for these spots to be more noticed in middle-aged or older people. But that doesn't mean they are normal or acceptable. The presence of xanthelasmas requires deeper investigation, especially if accompanied by a family history of heart diseases. A simple blood test can confirm if cholesterol is high and if there is imminent cardiovascular risk. Prevention in these cases is essential. Although they cause no pain or physical discomfort, xanthelasmas have a very important symbolic impact. They reveal a systemic imbalance that can compromise heart health. In some cases, they may also indicate other metabolic changes, such as liver dysfunctions. Being attentive to these manifestations is an important step to anticipate bigger problems and act before they become severe. Some people try to remove them for aesthetic reasons, but this does not solve the real problem. The focus should be on treating the cause, adjusting diet, practicing physical activity, and if necessary, using medication to control blood fat levels. The skin only shows what the blood hides. It is the surface revealing the risks running inside the arteries. Don't be fooled by the body's silence. A diet rich in fiber, with less saturated fat and more vegetables, can help reverse this condition, as well as abandoning harmful habits like sedentarism and smoking. Even simple changes like replacing fried foods with baked or grilled preparations already have a positive impact. It is possible to clean your arteries from the inside out, and your skin will thank you too. Cardiovascular health starts with routine. And stay tuned, the last sign we will reveal is, without doubt, the most important in this video. Chapter 5. Persistent paleness. Feeling constantly pale may seem like a vague symptom, but it hides important messages from the body. Persistent paleness, especially when not related to factors like cold or fright, can be a clear sign of poor circulation. If blood doesn't efficiently reach the skin surface, the face, hands, and feet tend to lose their usual color. This symptom is common in cases of heart failure. That is, the heart may be failing in its mission to pump blood properly. This type of paleness usually comes with other symptoms like dizziness, excessive tiredness, and shortness of breath. When the heart is weakened, it needs more effort to maintain adequate circulation. Thus, the skin ends up receiving less oxygen, becoming paler and dull. This condition is more common in people with a history of low blood pressure or anemias associated with heart diseases. Often, the body is already on alert without the person realizing it. Besides the pale tone, it is common to notice colder and even moist skin to the touch. These details indicate the body is prioritizing vital organs, leaving the skin secondary. When this happens, it means the body has entered a mode of silent emergency. At this stage, the risk of complications increases significantly. This is the type of symptom that cannot be ignored, even if it seems harmless. Paleness can also come hand in hand with muscle weakness. The person feels exhausted even after small efforts. This happens due to lack of oxygen in the tissues, as the heart isn't able to supply the necessary blood volume. Daily activities like climbing stairs or carrying bags become difficult. The routine begins to be affected without the person understanding the real reason, and the answer might be the heart. That's why any change in skin coloration should be taken seriously, especially if present alongside symptoms of low energy, fainting sensation, or breathing difficulties. In such situations, simple exams can identify heart failure or other related dysfunctions. Quick action prevents worsening and provides quality of life. The earlier you act, the greater the chance of controlling and reversing the condition. It's not uncommon for people to ignore this type of sign for months or even years. They think they are just tired or stressed. But the truth may be deeper and require urgent medical care. Don't wait for the situation to worsen to seek help. Listening to your body is the first step to protecting what is most vital, the heart. Paleness is a silent language that deserves to be understood. Keep reading, as we still have extremely revealing signs ahead. Chapter 4. Swelling and excessive shine on the skin of legs or ankles. Have you noticed that your legs or ankles are constantly swollen, with shiny skin marked by socks or shoes? This is not just common fluid retention. It can be a clear sign of developing heart failure. When the heart can't pump blood efficiently, fluid accumulates in the lower extremities. This accumulation forms edema, which makes the skin more tense and shiny. This type of swelling usually increases throughout the day, especially if the person spends a lot of time standing or sitting. When pressing with a finger, the skin forms a dent that takes time to return to normal, known as pitting edema. This is a clinical sign revealing circulatory overload and cardiovascular system compromise. It's not something that is solved with simple drainage or massages. It is an internal warning. Swelling may come with a feeling of heaviness in legs and difficulty putting on shoes that used to fit normally. In more advanced stages, the skin may become reddish, sensitive to touch, and even show cracks. This increases the risk of infections and other complications. The body can no longer hide what is happening internally. The skin becomes a direct reflection of the cardiac effort. Many confuse this symptom with kidney problems or peripheral circulation issues. Although these can also cause edema, cardiac origin usually has specific characteristics. One of the main signs is partial improvement when raising the legs. This happens because it facilitates venous return, temporarily relieving fluid accumulation. But the relief is temporary. The cause remains, and it is in the heart. Another important detail is that cardiac swelling doesn't improve with heat. On the contrary, it tends to worsen. This is because the natural vasodilation caused by heat demands even more from the weakened heart. In these situations, symptoms often worsen at the end of the day, even making sleep difficult. The person feels discomfort lying down, as the redistributed fluid in the body can cause shortness of breath. It's a difficult and dangerous cycle. Fluid retention also affects the function of other organs. It can cause sudden weight gain and abdominal discomfort, and all this can be confused with digestive or hormonal problems. That's why early diagnosis is essential. Consulting a cardiologist when facing this condition is more than recommended. It's urgent. The health of your legs may reflect the fragility of your heart. Chapter 3. Red spots on the palms of the hands or fingers. Have you ever noticed small, painless red spots or marks on the palms of your hands or fingertips? These signs are rare but extremely important. Known as Janeway lesions, they may indicate serious infections in the heart valves. This condition, called infectious endocarditis, is a medical emergency that can severely compromise the heart. The discrete appearance of these lesions deceives, but their meaning is profound. Janeway lesions occur due to the presence of microemboli, small fragments of infection that detach and travel through the bloodstream. When they reach the small vessels of the extremities, they cause these reddish spots, which are signs of systemic infection. Most often, they appear in people with a history of heart problems or artificial valves. But they can also arise without prior warning symptoms. These spots do not hurt, itch, or quickly change size. That's why many ignore them or confuse them with small allergies or insect bites. But when seen in the context of persistent fever, chills, night sweats, or extreme fatigue, they become a strong indication of internal infection. If identified, they require immediate medical attention. Quick diagnosis can prevent permanent damage to heart structures. Endocarditis can install silently, being mistaken for prolonged flu or common infections. However, it can destroy heart valves, cause embolisms, and lead to serious complications. That's why any unusual skin lesion accompanied by systemic symptoms should be investigated. Blood tests and echocardiograms are essential to confirm the infection. The sooner it's treated, the greater the chance of cure. Another relevant factor is that in immunosuppressed people or those with cardiac devices, the risk of endocarditis is even higher. This includes valve prosthesis carriers, pacemakers, or other cardiac interventions. For this group, any changes in hands or feet should be immediately reported to a doctor. Attention to detail can save the patient's life. Preventive medicine starts with skin observation. Although uncommon, Janeway lesions are considered important clinical markers. They have a name, history, and impact in medical literature. Ignoring them is like ignoring a loud alarm coming from your own body. And often, they are one of the first visible signs of a problem that rapidly worsens inside. Taking care of these lesions goes beyond the skin, is an act of protection for your heart. Chapter 2. Hair loss on legs or feet. Have you noticed a decrease in hair on your legs or feet without having done depilation or any other intervention? This may seem like an aesthetic detail, but can indicate a serious health problem. Hair loss in distal regions such as shins, ankles, and toes can be a sign of poor circulation. This condition is typical of peripheral arterial disease, often associated with cardiac conditions. Poor circulation happens when arteries are narrowed or blocked by fatty plaques. As a result, blood can't properly reach the extremities. And without blood, hair follicles do not receive nutrients. Result: hair stops growing, and the skin becomes smoother, colder, and discolored. This symptom is a visual alert that something is blocking healthy blood flow. Over time, other signs may appear, such as pain when walking, tingling, and difficulty healing wounds on the legs. These symptoms often appear together and are ignored because they are progressive. But when hair stops growing, the problem is already advanced. The risk is not only aesthetic. It can evolve to ischemia, necrosis, and even amputation if not treated in time. People with diabetes, hypertension, or high cholesterol are more likely to develop this type of arterial obstruction. This is because these conditions slowly damage blood vessels, reducing their elasticity and ability to transport blood. The heart needs to work harder to push blood to the lower limbs. And eventually, it can no longer supply all regions. Observing skin and hair can be a simple and effective way to detect this problem early. Dermatologists, angiologists, and cardiologists pay attention to these signs in their offices. They know that a symptom on the skin can reflect a much greater imbalance. That's why in clinical exams, this is an area that always deserves attention. Ignoring the absence of hair is missing a silent alert. Changing diet, exercising, and controlling glucose and cholesterol levels are fundamental strategies to stop arterial disease progression. In advanced cases, medication or even surgery may be necessary to restore blood flow. Early diagnosis, once again, makes all the difference. The body always gives signs. It's up to us to interpret them correctly. Chapter 1. Nails with dark lines. Have you noticed small vertical dark lines under your nails, looking like splinters beneath the surface? These marks are called splinter hemorrhages and may seem harmless at first glance. However, they can indicate serious health problems, including cardiac ones. These lines appear when small clots or inflammations damage the tiny blood vessels under the nails. They are, therefore, reflections of compromised circulation. The presence of these lines can be associated with infectious endocarditis and inflammation of the heart valves. When the heart is sick, small infectious fragments or thrombi can detach and circulate through the bloodstream. They may end up impacting vessels in the extremities, such as those under the nails. That's why this sign deserves attention, especially if accompanied by fever or unexplained fatigue. The body always warns. These lines usually don't hurt or cause direct discomfort, but are silent signs that something isn't right. They appear on one or several nails and don't disappear over time, like common bruises. This is because they don't result from trauma, but rather from failures in blood transport or microvascular infections. They are visible clues indicating the heart may be struggling against something more serious than it seems. Observing these changes is fundamental, especially in people at increased risk of heart disease. Patients with artificial valves, pacemakers, or history of infectious diseases should be even more attentive. These lines may appear together with other subtle symptoms like chills, night sweats, or shortness of breath. Even if isolated, they shouldn't be ignored. They are like the tip of an iceberg. Splinter hemorrhages may also be present in autoimmune diseases or vascular disorders. But when associated with the heart, they are serious and immediate alerts. Correct diagnosis depends on careful medical evaluation with clinical and laboratory tests. The good news is that with appropriate treatment, the condition can be reversed. But acting quickly is essential to avoid complications. The heart is a silent organ, but its failures appear in most unexpected places, including the nails. If you notice these lines, see a doctor. It's better to find out early and treat than to let the problem advance silently. Your attention to small details can completely change the course of a disease. After all, the clues are always there, waiting to be noticed. Now that you know the 7 visible signs of a potentially sick heart, I need to tell you 6 powerful habits to take care of your heart. Come with me. Habit 6. Walk 30 to 45 minutes a day. Walking 30 to 45 minutes a day is one of the most effective ways to strengthen the cardiovascular system. This habit activates circulation, improves tissue oxygenation, and reduces blood pressure. You don't need to run marathons to get benefits, just move consistently. Your heart thanks you for every step you take. Walking is a light aerobic exercise, accessible and safe for most people. It helps the heart work more efficiently, pumping blood with less effort. Additionally, it reduces bad cholesterol levels and increases good cholesterol, protecting your arteries. Walking also helps control glucose, lowering the risk of diabetes, which is a risk factor for heart diseases. Another direct benefit of walking is improving endothelial function, that is, the inner lining of blood vessels. When this lining works well, blood flows more easily, decreasing the risk of clots and blockages. Also, this habit promotes vasodilation, which helps control blood pressure naturally. In other words, walking strengthens the heart and increases its response capacity. It's a mistake to think you need to walk fast or at high intensity. The secret is consistency and practice time. Walking 30 minutes a day already offers immense benefits. If you can get to 45 minutes, even better. This can be done in one go or divided into 15-minute blocks throughout the day. What matters is the daily habit, not the performance. Walking also has a strong impact on mental well-being. It reduces stress, increases endorphin production, and improves mood. And as we know, high stress is one of the heart's villains. A less stressed heart is a healthier heart. Therefore, walking is an act of care, not only physically but emotionally as well. and that transforms quality of life completely. Starting can be easier than it seems. A walk around the block after lunch, getting off the bus a stop early, parking farther away. Small choices make walking part of your day. Over time, the habit strengthens and benefits become evident. And for those who find it hard to stay motivated, a good pair of sneakers and a lively playlist can work wonders. Turn this simple step into a revolution for your health. It may seem like an exaggeration, but walking daily is like a natural medicine for the heart. Habit 5. Drink plenty of water throughout the day. Do you remember to drink water throughout the day? This simple and often neglected habit has a direct impact on heart health. Adequate hydration helps keep blood more fluid, facilitating circulation and reducing cardiac overload. When we are dehydrated, blood becomes thicker and harder to pump. This requires more effort from the heart, which over time can cause wear. Staying well hydrated also improves oxygen and nutrient distribution throughout the body. Every cell in our body depends on water to function properly, including heart cells. Also, water regulates body temperature, aids digestion, and eliminates toxins. A hydrated body is a body that works in harmony, and this harmony starts with the simple act of drinking water. Another important point, dehydration can cause drops in blood pressure, dizziness, and arrhythmias. These symptoms, when recurrent, directly affect quality of life, and the heart feels these impacts. When there is not enough water, blood volume decreases, and pressure can drop drastically. Therefore, drinking water regularly is also a way to stabilize the circulatory system. A simple but powerful care. Many people wait until they feel thirsty to drink water, but this is a common mistake. The ideal is to drink water throughout the day, even without feeling the urge. Keeping a bottle nearby, using reminder apps, or setting fixed times are practical strategies. After all, prevention starts with details. And hydration is a detail with a huge effect. Besides helping the heart, water is essential for the kidneys, which work alongside the cardiovascular system. Together, they regulate blood volume and pressure. If the kidneys suffer, the heart compensates, which can lead to increased blood pressure. Drinking water preserves this vital balance. A silent partnership that supports your health from within. Habit 4. Sleep well, between 7 and 8 hours per night. Sleep is one of the greatest regulators of cardiovascular health. It is during nighttime rest that the body stabilizes blood pressure, regulates hormones, and recovers the immune system. Sleeping well is not a luxury, it is a physiological necessity. Without it, the risk of heart attack and stroke rises considerably. Studies show that people who sleep little or have poor quality sleep are more prone to hypertension. This happens because lack of rest raises cortisol, the stress hormone. As a result, blood vessels remain contracted longer, increasing blood pressure. This condition becomes chronic, silent, and dangerous. Sleep, therefore, is a natural protection against this threat. Besides regulating pressure, sleeping well directly influences blood glucose levels. During deep sleep, the body balances energy metabolism, which prevents sugar spikes and reduces diabetes risk. The heart benefits from this balance, as it doesn't need to compensate for excesses. A stable metabolism demands less effort from the cardiovascular system. Sleeping well is like giving your heart vacation every night. Another crucial point is the reparative function of sleep. While you rest, your body works on cell regeneration, including heart and muscle cells. Sleep is also the time when the nervous system organizes itself, reducing anxiety and stress. And as we know, chronic stress is one of the main triggers for heart attacks. A peaceful night's sleep is worth more than extra hours awake. Creating a sleep routine is fundamental. Sleeping and waking up at the same times, avoiding screens before bed, and reducing caffeine intake are simple habits that improve sleep quality. It's also important to create a conducive environment, dark, quiet, and comfortable. The body responds better when it understands it's time to rest. And the better the sleep, the more protected your heart will be. Recurring insomnia, on the other hand, may be a sign of more serious imbalances. If you constantly have trouble sleeping or wake up multiple times during the night, it's worth seeking medical advice. A sleep study can identify apnea, respiratory disorders, or chronic anxiety. Treating sleep is treating the heart. Don't underestimate this connection. Sleeping well is taking care of yourself on every level. Habit 3. Practice deep breathing or meditation daily. Deep breathing and meditation help reduce stress, one of the heart's greatest villains. When you breathe consciously, you activate the parasympathetic nervous system, which promotes relaxation and balance. This reduces heart rate and blood pressure. Constant stress causes the body to produce more cortisol and adrenaline, hormones that increase pressure and inflame blood vessels. This continuous state of alert overloads the heart and can lead to diseases like hypertension, arrhythmias, and even heart attack. With the daily practice of breathing or meditation, the body returns to its natural calm state. And a calm body means a more protected heart. Breathing deeply isn't just pulling air forcefully, but filling the lungs slowly and completely, holding the air for a few seconds before exhaling slowly. This cycle calms the heart rate and improves blood oxygenation. Over time, this practice becomes automatic, transforming your daily life into a sequence of balanced moments. A peaceful heart is a reflection of a peaceful mind. Meditation goes beyond a moment of silence. It teaches the brain to better handle pressures, react with less impulsivity, and maintain focus on the present. This reduces accelerated heartbeats, improves sleep, and even strengthens the immune system. And all this has a direct impact on cardiovascular health. Meditating is like giving your heart a daily hug. You can start with just 5 minutes a day. Choose a quiet place, sit comfortably, close your eyes, and focus on your breath. There are apps, videos, and specific music to help in this process. The important thing is to create the habit and allow yourself this moment. It's not about doing it right, it's about doing it regularly. Over time, the results appear. Many people report that by including meditation in their routine, they noticed a significant reduction in anxiety, better pressure control, and more energy. That's because inner calm directly reflects physical health. Body and mind are deeply connected, and the heart is the main link in this connection. Mental serenity translates into softer and safer beats. Habit 2. Reduce salt and processed food consumption. Do you usually check the amount of salt in the foods you eat? This attitude can save your heart. Excess salt is directly linked to increased blood pressure, which overloads the heart and blood vessels. When pressure remains elevated for long periods, the risk of heart attack, stroke, and heart failure increases drastically. Reducing sodium is one of the most important steps to protect the heart. The problem is not only the salt shaker on the table. Most of the salt consumed comes from processed foods, cold cuts, canned goods, ready-made seasonings, snacks, and even bread and cookies. These products have hidden doses of sodium that, consumed daily, accumulate dangerous effects. That's why reading labels and avoiding ultra-processed products is essential for those who want to keep the heart healthy and free from surprises. Besides salt, these processed foods are full of preservatives, trans fats, refined sugars, and chemical additives. All these elements contribute to inflammation in the body and disrupt metabolism. This puts the heart under constant stress. The result is a weakened cardiovascular system more prone to failure. Changing habits starts with more natural and less packaged choices. Reducing salt intake doesn't mean giving up flavor. Fresh herbs, garlic, onion, lemon, peppers, and spices are incredible alternatives to seasoned foods. Besides being healthy, they bring variety to the palate and contribute to a richer and more aromatic diet. The transition can be gradual, allowing the palate to readjust. In a short time, you'll notice how excess salt was unnecessary. Controlling sodium intake helps prevent bodily swelling, common when there is fluid retention. This eases the kidneys' work and consequently reduces cardiac overload. Less retained fluid, less effort for the heart to pump. A direct connection between what you eat and how your heart works daily. Habit 1. Avoid smoking and excessive alcohol. Few habits are as devastating to the heart as smoking and drinking excessively. Cigarettes are a silent enemy that attacks blood vessels, hardening arteries, and making circulation difficult. This increases the risk of high blood pressure, heart attack, stroke, and other serious heart diseases. Alcohol in large amounts raises triglyceride levels and can cause arrhythmias. Avoiding these habits is crucial for heart health. Smoking reduces blood oxygenation, making the heart work harder to supply the body's needs. Nicotine and carbon monoxide accelerate heartbeats and damage the endothelium, the inner layer of vessels. This favors the formation of fatty plaques that clog arteries. Each cigarette is a direct attack on the cardiovascular system, and the damage is cumulative. Alcohol, in turn, when consumed excessively, increases blood pressure and alters cholesterol levels. It can cause alcoholic cardiomyopathy, a condition where the heart muscle weakens. Moreover, it contributes to weight gain, dehydration, and liver problems, which indirectly affect the heart. Moderation is the key word. Social drinking with control is different from making a habit. Quitting smoking is undoubtedly one of the greatest gifts you can give your body. Each day without smoking, vessels recover, blood circulates better, and oxygenation improves. In a few months, the risk of heart diseases begins to drop significantly. In 1 year, is nearly half of what it was before. It's a real, proven, and accessible transformation. If quitting smoking or reducing alcohol seems difficult, know that you are not alone. There are treatments, therapies, and support groups that can help in this process. The most important thing is to take the first step. Recognizing the impact of these habits on health is the start of change. And every small victory counts. Your heart will feel the positive effects almost immediately. More energy, better breathing, deeper sleep, healthier skin. The benefits go beyond the heart. But it is in it that the greatest transformations happen. A heart free of toxins works better, with more efficiency and lower risk of failure. It's like replacing an overloaded engine with a light and well-adjusted system. And this difference changes everything. And if you want to continue receiving the best videos for your health, subscribe to the channel, because it exists for only one reason: to make you a healthier person with better quality of life. Helping you is my mission. In the video that now appears on your screen, I reveal the 10 incredible benefits of rosemary tea. Click on the screen and check it out.